Welcome everybody to another episode of Elevation 740, produced by Jetta Media and hosted by the LC Valley Chamber of Commerce. My name is Mark Losh. I'm the CEO of the LC Valley Chamber of Commerce. And my guest today is Kym Clift from TriState Health. Thank you so much for being here. I know your schedule is crazy. You have so much going on, but we're excited to hear all the new things at TriState Health and what's going on in 2026 and maybe a little bit of history for people who don't know anything about you.
Sure,
so tell us about TriState.
Well, TriState is a local hospital, one of the two hospitals in the LC Valley. We both serve very important roles here in the community, both definitely needed to serve this growing community here in the Valley. TriState's a little bit different. We were started by the community in 1955 through fundraising. So we consider ourselves to be kind of community owned. We're a critical access hospital. So we're a little bit different in terms of our funding and some of our limitations. But I refer to our organization as a unicorn. We are one of the 4 largest rural hospitals in the state of Washington. So we're pretty large for the type of organization that we are, and but we're large for a reason. It's because we have grown to accommodate the healthcare needs of the community, and as those needs have evolved, we have continued to evolve as well.
One of the unique things is you're locally owned.
We are locally owned.
Talk about that, please.
Yeah. So we're independent. We were started by a local community members back in 1955. They raised funds. The federal government provided some funds. And so we're governed by an independent board of directors that are local businessmen and women. And so some of them have volunteered for decades at the organization. They're very dedicated. And we're really just here. We get our direction from the community through our board and through our patients. And we just exist to serve the healthcare needs of the Valley.
You got some interesting programs and probably more that we can cover today.
Yeah.
But you have a school-based health program that you've got started?
We are partnering with Clarkston Valley School District. They recognized that one of the barriers to keeping kids in class and engaged at their greatest capabilities can be healthcare and access to healthcare. We all know that there's shortages across the country, and certainly we have shortages here in the Valley. And so school-based healthcare is not a new concept. They exist in many communities, but they are new to the Valley. It is a new concept here. And so we will be opening, it's essentially a clinic. We'll provide physical healthcare services and some mental health care services as well to students, so that if they have a need or if they just need to get a checkup, a regular checkup, or a sports physical, they can come to the clinic, be seen by our provider, and then hopefully go right back to class and continue their learning as we would want them to.
Is there cost involved in this, or is this a program that's, talk about that side of it. I mean, I went to school, you had the school nurse.
Yes.
And
they still have a school nurse, and they will continue to have a school nurse. And the school nurse will help make the determination if that student is best to be seen in the clinic. And so it is basically a clinic like we have on our campus, primary care, except for it will just exist in the school itself. And so there is a cost. It's operated by TriState, so it's not funded through the school district from an operating perspective. TriState will do that. And so we'll bill insurance just like we bill insurance if you come see your primary care provider on the campus. A financial burden for the patient, just like in our clinics, we have financial assistance programs as well.
Parents got to be excited about this.
I hope so. It's a new concept here, but at the end of the day, we are meeting the patients where they're at. And for that population, it's in the school. And so a parent to not have to pick up their child from school and drive them to urgent care and then maybe take them home or maybe take them back to school, that's a big chunk of their day that they have to accommodate. And so if we can provide that need and serve that purpose in the school itself, I think that's a positive thing.
So you've got another program that sounds interesting. I'm not sure what it means. Scrubs Camp.
Yes.
So I think of scrubs and the clothes. Talk about Scrubs Camp. What is this?
Scrubs Camp. It's one of my babies. It's, I think a lot of kids go through high school and they're not clear on all of the potential work opportunities in the healthcare field. And there's a shortage, and there's a growing shortage of nurses and pharmacists and physicians and every other position that exists within hospitals and clinics. And so Scrubs Camp is a one-day program that high school kids come for, and they get hands-on experience, so giving shots and taking x-rays. And we have some virtual experiences, and they talk to our providers and respiratory therapists and nurses and physicians, and they just get exposed to the different opportunities in healthcare. So maybe they already have a path that they're pursuing and they just want to experience a little bit more hands-on. And then we also bring in the colleges, and they can talk about how a student can make their career idea a reality, and what it would cost and what the process is. So it's just to guide students who might have an interest in healthcare and what those opportunities might look like.
I think sometimes people don't understand. It's not just healthcare wearing scrubs dealing with patients.
Yeah.
You're running a city.
A little city, yeah.
You have all of the trades.
Yeah.
All of the
Yes.
the financial side, all of the accounting, all the HR, HVAC, plumbing, electrical, welding.
Yes.
I mean, I've been able to tour your campus a couple of times, and every time you have an expansion, there's 1,000 industries involved in that expansion. So
Yes. Yeah.
it's great to have the kids exposed to that. There's more than just being a nurse in healthcare. This is a great opportunity in any kind of a trade or any kind of a discipline. You spoke a little bit about colleges, kids in high school combination. You've got some things going on, not only with Walla Walla Community College, but also with WSU.
Yes.
This is some big news.
Yes.
Okay, break it to us.
So the residency program, I think, is what you're referring to. So there is a growing physician shortage across the country, and that shortage is going to grow exponentially. And part of the challenge is the progression of a physician through their educational processes. They get their undergraduate degree, they go to medical school, and then they have to match in a residency program that's a 3-year program. And that residency program, they're essentially working physician. They're seeing patients, but they're also being exposed through curriculum and rotations to inpatient and emergency room and labor and delivery. And so they get a breadth of exposure if they're going to be a primary care doc. And so they have to match with the program. And there aren't a lot of programs that are in rural settings across the country. And it has been shown that physicians stay within 60 miles of where they do their clinical rotation. So if a physician resident to be matches or seeks to match in a rural area, they want to practice in a rural area. And so we want to give them that ability to have that opportunity to do their clinical practice during their residency in a rural setting. And so we're working with Wazoo's College of Medicine to stand up a rural residency program here in the LC Valley. So we'll have resident physicians that are rotating through the different places of care, settings of care, but they'll also have a clinic, and so they'll see patients kind of in a primary care setting as well. So it's a great thing for the Valley. It'll help us retain primary care providers. It'll help us increase the number of primary care providers that we have, and we know that they want to be here because they actively selected us to do their residency here.
When does this get going? Is it going now? What's your timeline?
We're in the process of setting it up. It takes a long time. We have to develop the curriculum and the relationships because they'll do some clinical rotations here in the Valley, maybe some at St. Joe's, but probably some up in Spokane as well. It's a 3-year program, so each year we'll have 3 new residents. So when in the 3rd year, when it's fully staffed, we'll have 9 residents.
And then every year with 3 coming in, it just keeps...
Yeah, 3 will go out and 3 new ones will come in. It's really exciting. It's a great opportunity for the Valley.
I want to go back to the colleges again.
Yes.
You've got some relationships with LCSC. You've got some relationships with Walla Walla Community College. Talk about how, and with the high school. So it's kind of like...
Yeah.
It's this almost path designed to help kids through a way to get into healthcare and get an early start and
Yeah.
get a good understanding of what it is. Starts with the scrubs, get exposed to it, and then say, I kind of like this. Now I can go talk about that.
Yeah. Well, it starts with the scrubs camp, so the high school students. And the Lewiston High School has a medical assistance program. And so those MA students come to our scrubs camp. And so they get exposed to the hospital setting and they get that full day experience, hands-on experience. We partnered with Walla Walla and Clarkston High School to re-engage a CNA program, a clinical nursing assistant program at the Clarkston High School. That's been really successful, very positive. They have an average 10 to 15 students every year in that program. And then they'll come, part of the program is they do clinical rotations. So those students will come to our hospital. They'll kind of work side by side with the nursing staff and CNA. They'll go to other clinical care sites as well. And so they get that hands-on exposure. But more importantly, they graduate high school with a career path. So they can graduate high school and go right into healthcare and work as a CNA. A lot of them are choosing to go to nursing school. And so a CNA is a precursor to that. So they've already checked that box. So it's a great opportunity. Walla Walla has been a fantastic partner. They provide the instructor, and then TriState funds it. We fund the cost of that for the program for the high school and the students. So there's no out-of-pocket costs for the students. And then we partner with Wazoo with the residency program. We partner with the medical schools. We have lots of medical students that come and do clinical rotations at the hospital. And we have lots of nursing students that come and do their clinical rotations. So we do a lot of education. I think it's what keeps us engaged. It's what keeps our staff excited, because they have kind of new, young, fresh minds coming on site all the time. And it's a great environment.
You just had an amazing event over the winter.
Yes.
Festival of Trees.
Yep.
Broke some records.
Yes.
Tell us about that.
Yeah. 41 years. Yeah. It's been a positive event for the hospital and the foundation and the community. We have it every year. It started as just a tree lot in our parking lot when they first launched it. And now it's this big event where trees are developed throughout the whole year by designers, and they're themed and they're extravagant, and it's a really fun event. And, as I mentioned, TriState is we're a critical access, but we're also not for profit. So we are not funded through tax dollars. So we are funded solely through our operations and then through philanthropy. And it's really philanthropy dollars that has helped TriState with their significant growth over the years. And the Festival of Trees is a really big part of that. This last year was really special, of course, because, we had this unexpected bidding war on our second to the last tree. And, Gary Hughes really wanted that tree, and somebody else really wanted that tree for different reasons. And so, but, had it not been their commitment to the organization, nobody's going to, purchase a tree for $420,000. I mean, Gary really, he has been a long-term supporter of the hospital, and his name is on our courtyard of our new inpatient wing. And so we definitely, he has a place in all of our hearts because TriState has a place in his heart. But yeah, it's an amazing event. I encourage anybody to come out during the family days and see the trees and just kind of experience the ambiance, because it's pretty special.
Now, that's all managed by your foundation.
Yes, by our foundation.
Speak about the foundation a little bit for me.
Well, the foundation, it's a small group. There's just a handful of individuals that run that, but every single dollar that they raise goes right back into the hospital, and they fund a lot of things. They fund a lot of things that our patients want to see updates on, and then they fund big things like they had a capital campaign when we were building our inpatient wing, and they raised $9 million in a fairly short time frame. And again, that's the community's commitment to the hospital. They recognize the value and the importance of the care that we provide to their families and neighbors. And so people just step up and they support us in lots of ways. But through the foundation is a really important way.
So one of the things that's important is maybe people don't know what all you do there. And I have a very long
You have a list,
I have a very long list here. General surgery,
Yeah.
imaging center, infusion center, intervention, pain consultants, treatment, neuropathy, orthopedics, pulmonology,
Yeah.
rheumatology,
Yeah.
sleep lab, urology, wellness clinic. I'm only halfway through the list.
Yes. Yeah.
What are some of the new programs or new services that you brought on recently that people may not know of that know of your organization?
I would say a couple of the most recent ones. One is OBGYN. So we have 3 providers now in a OBGYN clinic. We don't deliver babies at the hospital. St. Joe's has the birthing center, and so that's where our providers go to deliver babies of community members. But we have the OBGYN providers, which, as you know, that was we had one OBGYN physician in the Valley for a long period of time, and that's just not enough. And then the other one is orthopedics. So we have an orthopedic practice. And I would say that list of extensive specialty clinics is because when we hear from the community that we have a gap in healthcare, when somebody has to leave the Valley to go to Spokane, typically that's where they have to travel to, that's a burden. It's 2 hours up and 2 hours back. And if you are sick or not feeling well, it's a long time to sit in a car to get care. So those exist because TriState fills the hole. That's really our purpose. If there's a gap in the healthcare community, we try and fill it.
You're always adding new things and doing new things and adding on. What's new that I haven't brought up or we haven't discussed? Is there something else that we should know about?
We have 2 new general surgeons starting, and we're excited about them. They both use the Vinci robot. We brought the Vinci robot in-house about 3 years ago.
Tell people what the Vinci robot is, because I've seen it, but if you haven't seen it, you don't know.
Yeah, it's pretty amazing. It allows us to do minimally invasive surgeries on patients, and so instead of getting a couple inch incision, it's like a pinprick. And so it's literally a robot that does the surgery that's controlled by the physician at a control panel. But it's as I said, it's minimally invasive. And so the recovery time is extensively less than an open surgery or a laparoscopic surgery. And so patients love it because they can return to work faster or just generally heal faster and get up on their feet quicker. And our surgeons really prefer to use that approach as well. So we have 2 new general surgeons that are starting that use the robot. And so we're excited about that.
And that also because of shorter recovery time, less infection problems.
Yes.
All that less means less cost.
Yes.
Less dollars.
Yes. Yep.
I saw a demo when they first came out. It was amazing what they could do.
Yeah. It's pretty neat.
It is. This has been great.
Yeah.
And I know there's so much more that we could cover.
Yeah.
I hope we get to do this again. What are some things that you want people to know that TriState is working on, doing, or that we didn't cover?
I think just that, we have our eyes open, we have our ears to the ground. We want to hear from our patients. I think a big thing that we didn't mention is TriState's a 5-star hospital for patient experience, and that's based on patient feedback. So surveys that patient completes for CMS, they rank us. They rank every experience that they have, and they have ranked us 5 stars from a patient experience perspective. And we're really proud about that because not only do we want our patients to receive high quality healthcare, but we want them to have as good of an experience while they're getting cared for, treated, and getting well. And so we're really proud. There's not a lot of 5-star hospitals across the country, and so we're really proud of that.
You should be.
Yeah.
You have a great staff.
Yes, thank you. We do.
Kym, tell us about how people can reach you or learn more about TriState Health.
Sure. So we have a very robust website. It's at tsh.org. We have information about all of our services, all of our providers. If somebody is trying to establish care with a new provider, we have a new patient form that they can fill out and submit, and then we match them with the most appropriate primary care provider that will meet their needs. And so we also have a pretty robust social media presence. great marketing team. And because we consider ourselves to be a community-owned hospital, we're as transparent as we can be about the goings-on at the hospital. And so we have a pretty active presence on social media as well.
Kym, thank you much for being here today. It's exciting to hear all the news. You're doing a great job. And what you're doing in the community is powerful.
Thank you. Thank you for having me.
You're most welcome. Thank you, everyone, for watching this episode. My guest was Kym Clift, CEO, TriState Health. This concludes another episode of Elevation 740, produced by Jeddah Media, and I'm your host, Mark Losh of the LC Valley Chamber of Commerce. We'll see you on our next episode.